Well, Ollie's got a tumour, and he was diagnosed last October in 2000. And the vet at the time told me it was going to, I said, you know, is it serious? And he said, well, we're talking about weeks, months, but certainly not a year. Well, the treatment is quite frankly nothing short of miraculous, because I've got a dog with me that should be here. And he's fit, well, runs around, he's quite happy.
Oliver came to the veterinary surgery of John Carter in Harrow. John had treated several terminally ill dogs with his own preparation called CV247 in conjunction with a wholly organic diet.
Rudolph was diagnosed with having cancer of the spleen in January '99. I took him into my vets. I said, well, what's his chances? He said if he survives the operation, he might only live 3 months. I was devastated. Anyway, they offered him chemotherapy, but then he developed a heart murmur, so he couldn't have that. And I asked about alternative treatment, and she said she'd make inquiries. Then one day, towards the end of April, so it was coming up to the end of his life, I went in to get some more heart tablets, and she was very excited. She'd got a newspaper cutting of John, and she said, look, I can't do any more for him. Give John a go. So I got in touch, phoned up next day, and John said, come in this evening. He said, well, you realise there's no guarantees. I said, well, no, we've got nothing to lose by trying. And basically, Rudolph has never looked back. He's well, he's happy, his quality of life is excellent. He's just so good. And I owe it all to John, because without John, Rudolph wouldn't be here.
John Carter had felt compelled to develop an alternative to the traditional and very toxic treatments for cancer, radiotherapy and chemotherapy after several tragedies in his own life.
When I lost my dog and 3 close friends from cancer, despite all the conventional treatment, I was quite frankly very shocked. I thought because it's a defect in nature, there must be an answer in nature. That made sense to me. So I started reading all I could about cancer, both everywhere I could. I used to go to health food shops and read how to cure cancer, dozens of books on how to cure cancer, you know, but you might get a little clue from each bit. And I used to go to Norfolk Park Library and read research there, books on biochemistry and so on. I read all I could about the treatment of cancer, as much as I possibly could, and I was really, it's all I ever thought of for 12 years almost. And I used to go on holiday and think, you've got cancer all the time, you know? Because of what I'd seen, I was determined that the treatment I found would not in any way decrease the immune system or do any harm to the patient. And I spent several years researching, and I eventually found it. It gradually came in my mind, and I was treating a dog with a very large tumour on its neck, and I suddenly thought of something, and I gave that dog the treatment. I got the chemicals I needed for the treatment. I gave it to the dog, and to my amazement, the tumour shrunk up, and I couldn't believe it.
Right, Bozzy was supposed to have his leg amputated. When the vet told me that he was going to have his leg off, I immediately tried to find some alternative treatment. I'd had a friend who said that she'd taken her dog to a clinic, and it was John Carter's clinic, and therefore she said, give him a go. So it's the only alternative I had, so this is where I came. I do a regular ultrasound, and every other couple of months they tell me, yeah, he's fine, he's fit, no tumour at all.
Grateful clients are one thing, but CV247 needed to be tested on animals in a scientifically controlled laboratory environment. John was put in touch with Professor Peter Beverley at University College.
The big breakthrough came in 1993 when I was visited by a solicitor and cured his dog of cancer. And he said, I'm associated with University College, let me introduce you to people there, and he did. And I met that very good man, Professor Peter Beverley, who agreed to conduct a series of trials on it, although he was incredulous at first, but he saw my evidence and was impressed. And the trials proved that cancer, that what it did, it caused a statistically highly significant reduction in the rate of growth of cancer with no side effects. And from there I formed a company called Ivy Medical Chemicals, and we visited the Veterinary Medicine Directorate and talked to them about getting an animal license, and through their advice we treated over 70 dogs and cats with confirmed cancers, monitored by the chief editor of the Imperial Cancer Research Fund. With such results, we've applied now for a license.
As I say, it's not claimed that it's a cure for cancer. There's no such thing. You can only treat and hope that it will result in some kind of reduction, or at least that the patient is better, getting better. In some cases, all you have is a marked improvement in the animal's well-being, which alone sometimes is a winner, because what are the alternatives? Put down the dog immediately, or cat. You never know what would have happened. This way, you have a chance. Now you can offer something. You can say, well, we have got this drug. It's not fully proven yet, but there have been cases of success, and certainly there have been cases where the animal has gone completely better. The interesting thing is that there are spectacularly good results as well as total failures. So you can't, as I say, claim that this is a panacea for all.
Then things took a dramatic turn. People who'd been diagnosed with terminal cancer heard about John's work with pets and came to him, begging for his help. Fred Porch had lost one kidney to cancer, and the disease had spread to his lungs. Expecting to die, he came to John for CV247. 7 months later, there was no trace of lung cancer. Dr. Ros Taylor monitored Fred throughout John's treatment.
My feeling is that there is definitely something in this treatment. Some patients, sadly, have progressed regardless of having John's treatment, but they tend to be people who have got very advanced cancer. But some of the patients, and I'm thinking particularly patients with prostate cancer and kidney cancer, as long as they have a fairly low bulk of disease, i.e. they're fairly early in their disease, they seem to be dramatically responding.
For real credibility, though, and to get the CV247 regime to those people who really need it, John needed proper clinical trials to take place. Now, most trials involve a single chemical compound and are funded by wealthy pharmaceutical companies. CV247, though, is a mixture of ingredients that occur naturally in good foods, accompanied by an organic diet. It's a holistic treatment. Where would he find a cancer consultant with a strong reputation, yet the breadth of vision to take on a rather eccentric vet and his concoction, with no financial backing from a major pharmaceutical? Eventually, he found the man willing to put himself on the line. A young, lateral-thinking high achiever, voted Hospital Doctor of the Year 2000. Robert Thomas.
Some of my colleagues think I've gone out on a limb with this study because it's not exactly conventional in its endpoints. But my way of thinking is this cancer is a very complex, devastating disease in our society. And if we go down the same line as everyone else, we might actually miss lateral points or not see the wider picture. I mean, there was a famous quote by Socrates to say that the majority is not always right. So we shouldn't be just following the herd. We should say, let's take a step back. Let's think of all routes. Now, this route is not conventional. It's come from a very unusual track record. But, you know, why not? I mean, we do plenty of conventional studies and plenty of laboratory studies, and there's room to do the odd sort of slightly maverick sort of trial, and I'm interested by this.